anterior interventricular sulcus is pretty oblique. And the left ventricle makes up the apex, so this is the left ventricle. If you guys palpate the left and the right ventricle, you'll be able to feel that the walls of the left ventricle are a lot more muscular and rigid than the walls of the right ventricle. And then if you turn it around, you can see the posterior interventricular sulcus a lot more vertical. And then for testing, so again, if I were to test you on the real heart, if I wanted to test you on the sulcus, a sticker would be spanning the width of the posterior interventricular sulcus. If I wanted to test you on the vessel that runs down the posterior interventricular sulcus, there would just be a pin in the real heart. And what vessel is found in the posterior interventricular sulcus? It shares almost an identical name. Posterior interventricular branch of which coronary artery? The right coronary artery, yes. And then for the anterior side, if I placed a pin in the sulcus, what vessel would I want you to identify there? Anterior interventricular branch of what? Left coronary artery. Remember, even though the vein runs through that sulcus as well, the vein isn't testable on the real heart, just the artery. Okay, moving up. So, on the anterior side, these flaps of tissue, these are going to be the auricles of the atrium. So the auricle of the right atrium and the auricle of the left atrium. So because this heart isn't filled with blood, the auricle and the atrias aren't ballooned up like they normally would be. The auricles make up most of the atria. So because of that, if there is a pin on the real heart externally, I want you to identify the auricle. If I want you to identify one of the atria on the real heart, the pin will be inside of the actual chamber. Does that make sense? Okay. Does that make sense? I wasn't convinced by all of you. Yes. Does it make sense? Yes.
Yeah. Can you lift it? Do it again.
Yeah. So again, if the pin is pointing to the outside of the atrium, it's the auricle I want you to identify. But if the pin is on the inside of the atrium, then it's the actual chamber, the atria itself, that I want you to identify. Okay? Okay. So we're going to start off on the right side of the heart. So turn your heart to the posterior side. So what two vessels are dumping into, what two large vessels are dumping into the right atrium?
Superior, inferior vein.
Yeah. So depending on how much your heart was cut when they excised it from the animal, these two vessels might not be visible. But if you guys look up here, this opening here, that's going to be the superior vena cava. Then there's this little bridge of tissue. And then this vessel down here, that's going to be the inferior vena cava. And there should be a bridge of tissue separating both of them. So I'll go around and see if you guys have the vena